Now, being prepared for the third COVID-19 wave hitting us is crucial, says Dr. Gilles van Cutsem from Doctors Without Borders. While getting a vaccine is a matter of national and international concern, he says there are small, low-cost, high-impact strategies that can be put in place in every hospital right now that will strengthen our healthcare system. He joins us live now on Wednesday lunchtime. Dr. van Cutsem, good afternoon to you and welcome. Before we talk about the strategies, first vaccinations given today, no doubt you've been aware of it and witnessing it. Are you confident that we might be turning a small corner today?
Yeah, it's fantastic news. I'm very happy. We start with vaccination. Of course, you know, you said it. We have 500,000 vaccines. We have 58 million population. The current vaccination. Well, we will not manage to avoid a third wave as long as you don't have a very significant amount of the population that is vaccinated. We'll protect healthcare workers, which is great, and then we'll protect the most vulnerable, which is also essential. But this will not it will not prevent a third wave until we have a large proportion of the population that is vaccinated.
And there are lessons, Doctor, from the second wave that you point out. You say that patients died because of a lack of the basics. I'm assuming things like water, oxygen. What happened? Why did that happen?
Well, I mean, so with the second wave, hospitals were so overwhelmed with patients. The number of staff per patient was so low that you had a lot of inexperienced or disorganized staff, and you didn't have enough staff. So what happened? Something we forget is that in normal hospital circumstances, a lot of functions are being filled by the family of the patient. Family of the patients is giving patients to drink, is giving them food, helps them to go to the toilet, calls the nurse when there is a problem. In COVID wards, family is not allowed. So all those basic tasks fall on the shoulder of nurses who are already short-staffed and who are already overwhelmed. So what happened during the second wave is that because of hospital overload, people died from the most basic things because they were not given enough to drink. People died of dehydration, of hypernatremia. People died because their mask was misplaced and nobody put it back on. People died because they were off oxygen whilst trying to go to the toilet because nobody had helped them to go to the toilet, and patients who need oxygen can't go off oxygen, so people died because they went to the toilet. So something that can be done to prevent that is to look at task shifting, hiring low-level entry-level staff. In South Africa, it's nursing auxiliaries, but in other countries, we can use other cadres, even volunteers. Doctors Without Borders just hired a number of lay people that we call ward attendants in Lesotho to fulfill the basic tasks so that the nurses can and then focus on their medical tasks.
Doctor, I was very interested to read in a piece that you penned about the importance of the night shift in this process. Why is that critical?
Well, because when your hospital and your staff is overwhelmed, well, always in general, during the night you have less staff. And if in addition to that your staff is tired, then what happens is that you have very little support and very little monitoring during the night shift. And our experience is that the majority of deaths happened during the night shift because these lack of the basics of monitoring of oxygen saturation, repositioning of masks, basic patient support, that happens even less during the night. So you need to be aware of that, and you need to ensure that, first of all, there's adequate staffing, but also adequate supervision during the night, and that there is very, people who need oxygen, they need to have their oxygen during the night and during the day, of course, and they need to have their oxygen saturation being monitored day and night. So I mean, those are simple things, but that are extremely important in terms of saving lives. And of course, the last one is the first one. It's oxygen, oxygen, oxygen. Hospitals can, and I'm sure many are already planning for adequate oxygen during a third wave, because even in relatively well-prepared hospitals, we still had insufficient oxygen capacity.
Just a final question. You outline the importance of equipment, basic supplies. You talk about auxiliary staff, but it's also about management and logistics. You make the point that emergency response requires a great deal of coordination. Do we have sufficient skills at hospital level to get that right, do you think?
So I am not sure I can completely answer that question. I think that's for the Department of Health to answer. But we can start preparing for this now. We know that when there is a massive influx of patients, then it's too late to start planning and organizing. Often we have to reshuffle staff from different departments, and starting to organize at that point, it's late. So I think by now, hospitals can prepare by ensuring already a clear organization of what will happen when the third wave hits, and already clearly identified managerial capacity with teams that are prepping for a new influx of patients.
I thank you for your insight, Dr. Gilles van Cutsem from the organization Médecins Sans Frontières, Doctors Without Borders. This is